Welcome back to the Dr. Melissa Show. Today we're going to talk about frenectomy. So this is a topic that is becoming more and more prominent in the dentistry world, and it's not something that's very commonly known. So I want to kind of share a little bit about my experience in my dental practice, as well as invited some parents who've gone through it as well with their babies and children, and then we can kind of share all our experiences, so hopefully helping other moms out there and other parents to understand a little better about what this is. So just a little background information. I graduated from dental school in 2013. At that time in dental school, they really didn't teach that much about what frenectomy, the benefits of frenectomy, or why that's necessary. I became more exposed to it during my postgraduate studies and continuing education about new technologies involving lasers. My personal experience with why frenectomy is important and why I'm passionate about it is during the fourth year of dental school, I became a new mom, and going through that process of trying to breastfeed and still finishing school, I didn't realize that the whole process was more difficult because my child had a tongue tie, but I didn't kind of connect the dots until later during my studies about lasers. So my experience was very difficult because I just assumed that was what breastfeeding is supposed to feel like, but it was very painful, and my baby was up every hour in the night, and so I was very sleep deprived trying to finish school. So it just made a very impactful time in my life where I struggled a lot. And so when I became a dentist and learned about benefits of laser frenectomy, I decided to offer that, even though it's not a very common thing to offer, just because a lot of practitioners are scared to touch babies. There's a couple reasons why I think it's pretty important. But in terms of professional studies on this topic, it started coming out in 2010. So a lot of my oral surgeon friends, when I talk to them, they still would do frenectomies with scissors or scalpels, and those are kind of the more traditional ways to do them. The only issue with that is more post-op bleeding and infection. So now it's becoming more prevalent that lasers are becoming the ideal choice for this procedure. In 2015, the National Institute of Health published an article with the Journal of Applied Oral Science. They did a study on over 100 infants under 30 days old. They follow through these babies and kind of monitor their latching abilities, their sucking, swallowing, and breathing. And after the frenectomy procedure, they followed up with how these babies are doing at the 75-day-old babies. And the study kind of confirmed that the babies did have better latching, better sucking, swallowing, and breathing are all improved. So now there is a lot more information out there regarding scientific backing on this procedure and how it's benefiting babies. So I'm going to talk a little bit about the background of what this even is. So some babies are born with a little bit of a tongue tie and lip tie. Usually there's about 3 million cases in the U.S. per year. And what this is it's a short, tight band of tissue under the tongue, which can tether the base of the tongue all the way to the floor of the mouth. Sometimes it can tether the tip of the tongue, sometimes the middle of the tongue, sometimes the back of the tongue. This tethering can affect how the baby can latch during breastfeeding. And later on in life, speaking and eating are also affected, as well as oral hygiene. When they're adults, it can affect playing musical instruments, kissing, and licking food or lips. There's restricted movement on the tongue throughout their lives. The reason why this happens is during development, there are certain cells that are programmed to die in a process called apoptosis. If that cell does not get the message to dissolve, they will persist. And sometimes the tissue under the tongue will persist. So imagine when your fingers are developing, the skin between the fingers, if those cells did not die, then you would have wet fingers, kind of like a frog, for example. So for babies, it's very rare that all the tissue dissolves perfectly. But effective breastfeeding requires that the tongue has more freedom of movement during the sucking and latching process. If the tongue cannot extend to the right position, the baby will end up chewing on the nipple instead, because the tongue will protect the nipple from the bottom gingival tissue and the gums. So this can result in pain and damage on the mom's side, even bleeding on the nipple. It can cause infection for the mom, as well as interfere with the baby's ability to effectively take in breast milk. And that can lead to other consequences as well, such as poor weight gain, difficulty breastfeeding, the mom losing milk supply, or having kind of engorgement as a result. So I kind of want to open up the floor and see if you guys have some experience with what you dealt with before you had the frenectomy procedure with your babies.
Well, before we did the procedure for our daughter, it was very, very painful, and she tore up both sides, and I knew that I wanted to do something right away to fix that, because with my other two children, they had also tore me up, and I did not know that you could do something to correct that. I just thought that was normal. And so when we found out about this laser, we decided to go for it, and it's been amazing. I've healed up, and I don't have any pain feeding her, and it's just really a good choice.
The baby sleeps a lot better than our first two children did.
Mm-hmm. Yeah, she's sleeping 4 to 6 hour stretches at night.
At 8 weeks old.
Mm-hmm. 8 weeks old.
So. Yeah. What was she doing that before?
Well, we brought her in at 7 days, so we didn't really have a pattern of anything at that point.
So the pain that the moms experience sometimes can lead to the mom wanting to stop breastfeeding, because if it's so painful for the mom and the mom's experiencing infection and swelling and things like that, it can kind of move on to the mom giving up on breastfeeding. And so that's something that some moms had to experience without really understanding why that happened. And they didn't know that there's these tissues around the lip or the tongue that's preventing that from happening. So there's two ways that moms can figure out that if there's something different about this breastfeeding experience, whether it's your first time or in the future, other kids, is when you feel like the baby's adding too much pressure on the nipple itself, where kind of like what Kathy was sharing, that it was painful. It's, it may be discomforting to some moms to start breastfeeding at the beginning, but if it's so painful that you're trying to avoid this behavior, then it might be beneficial to check with your lactation consultant or pediatrician to see if there is any kind of tethering of the tongue or the lip that prevents latching properly. Sometimes the lip tie will prevent the lip from flaring out. So it's going to curl in when the mom is trying to nurse. And so that curling in can also contribute to hurting the nipple on the top part. If the tongue's not coming out properly, then it's going to hurt the nipple on the bottom part. So there's a couple classifications with different tongue ties and lip ties. So the tongue tie, the worst classification is class 1. This is when 100% of the tongue is restricted because the tip of the tongue is tethered to the floor of the mouth, which means when the baby tries to lift the tongue, you'll notice that the tongue will look like a heart-shaped tongue. And this is very difficult for the baby to move that tongue out to protect the lower gums from hurting mom while trying to breastfeed. The second class of the tongue tie is usually when 75% of the tongue is restricted. The tether will reach about halfway up the back of the tongue to the floor of the mouth. This will interfere with breastfeeding usually as well. The third type is when 50% of the tongue is restricted, but mostly in the back, posterior section of the tongue. Sometimes the babies are okay with breastfeeding, but sometimes they may still be getting a lot of air, clicking sounds and different things where they're kind of getting frustrated. And you'll also notice that they're not wetting maybe 6 to 8 times a day, which means they're not getting enough milk throughout the day. And then there's a fourth type, which is just fibrous attachment, which is very hard to find. A lot of times we have to lift the tongue and kind of show the parents that the tongue looks asymmetrical because the tether is not allowing the tongue to come out evenly. So half the tongue might lift up more than the other tongue, the other side, and it kind of looks like half the tongue is larger. This is more submucosal attachment and can still interfere. So that's the tongue classification. With the upper lip classification, it's the opposite. So class 4 with upper lip is actually the worst type. This is when the tissue will wrap around the hard palate and you see a little small central notching around the upper gums where the gingival tissue is. And class 3 is when the gum line kind of stops where the front teeth are expected to come out. This is when the lip is still very likely to kind of curl in when the mom is trying to breastfeed. And then class 2 is when it's attached at the top of the gum line. And sometimes the babies do allow pretty good movement. And with proper lactation consultant strategies and position of the baby, you may even get away with not having to do anything and the baby will improve. Class 1 is very rare. This is when there's absolutely no tether, no visible attachment in the frenulum. And on Dr. Gahari's website, he does a lot of frenectomies. He's seeing over 1,500 babies, and he's never seen class 1, which means all babies usually are born with some kind of tether. It just depends on how severe it is. In dental school, what they taught us was, this tether is fine, and when the baby starts walking, the baby might fall and break that tether naturally. So the baby might learn to walk and kind of trip, and then you'll see the baby bleeding around the gum line on the upper lip, and that's natural. That's just the baby kind of tearing that naturally. But if these are not treated as the baby grows up, around age 2 or 3 when they're starting to talk, some of the speech that may be affected include the T sound, the D sound, Z sound, S sound, the th sound, TH sound, L, and R. So they're going to have a problem rolling their R's and differentiating between L and R sounds. So I'm going to kind of talk about, if you guys can share a little bit about your babies, did you feel like your baby was more gassy or colicky or, anything related to that before you had the procedure with your baby specifically, like thriving?
So from my experience, I definitely had pain, and I had open wounds, but I also noticed that our daughter had made clicking sounds when she was nursing, and she didn't, I think she was gassy, but she didn't show crazy signs that made us worry. And the other thing with her was that regardless of the pain and the clicking, she was gaining weight. And so that was something that we were told by our pediatrician that, it's not a big deal. And if we sent every baby that had a tongue tie to to get a frenectomy, then all babies would go. And but the biggest thing for us was just the pain. And she never slept until she was well over a year. She was up probably every 2 hours, 3 hours if I was really lucky. But definitely there was a lot of clicking, and I felt like was constantly feeding. Like she always wanted to eat.
Mm-hmm. Like she was constantly hungry. Yes, kind of your impression.
Yeah.
I think that's my experience too. When I was going through that with my baby, it just felt like every hour the baby was up too. And so I just never got to sleep, and I didn't realize how hard it was to study for national board exams and trying to breastfeed. I was like, I did not plan for this. But yeah, that was very difficult. That was one of the signs that the breast milk intake was not efficient. And for the mom, the breast engorgement can cause the fluid to be trapped in the breast tissue, which can start feeling hard and painful and swollen. So sometimes it feels like little rocks in the breast tissue. And this is because of incomplete drainage during the breastfeeding process. So some moms will use a pump to try to release the extra milk. Otherwise, it's going to cause a lot of discomfort, and the milk ducts will start becoming blocked. And then that's more likely for bacteria to kind of sit still and cause infection, especially if the nipple is damaged and there's bleeding. There's more ways for bacteria to get in as well to infect the mom. And so sometimes the mom has to experience flu-like symptoms where they're kind of sick, and the doctor will have to prescribe antibiotics. By then, the antibiotics will go through the body and also pass on to the baby, which can affect the baby as well. So for the new mom, lack of sleep and possible anxiety and depression can be associated with this whole process, especially if it's not smooth and frustrating, which, sometimes it's important to consider the mom's health as well as the baby's health, even if the baby is able to thrive and still grow, but at the cost of the mom being exhausted and really worn out at the time. How do you feel as a dad watching your wife go through this?
Well, you hesitated for a second there.
Yeah.
And so I was thinking, as a dad sitting in this room right here, I feel a little uncomfortable because we're all talking about breastfeeding. And, my experience on that subject is incredibly limited. But overall, at first, honestly, I didn't think much of this as a procedure initially. I thought, for 6,000 years, babies haven't been getting frenectomies. This can't be that big of a deal. But I could tell that she was in a lot of pain, and the baby didn't seem like it was getting as much milk as she needed. And one thing Kathy didn't say is her sister is a lactation consultant, and she came over and talked to us a little bit about it. And when she actually showed me the physics of how it works, you can obviously see the tongue tie and the lip tie that our baby had, and did a little bit of research and realized this is really something that could help. And so we got in touch with Dr. Melissa and got it taken care of. And from my perspective, the observational differences were we didn't have to go to we were able to continue breastfeeding. We didn't have to go to formula. But Kathy and the baby were a lot happier and got a lot more rest. We already have 2 other children, so Kathy had her hands full. So every little bit helps. So yeah, it was a very noticeable difference. It was good.
So according to the American Academy of Pediatrics, breast milk has the ideal mixture for the baby. It has vitamins, proteins, and fat. And the most important difference between formula and breast milk are the antibodies that help the baby fight off diseases, viruses, and bacteria. So the first months of the baby's life is very vital because that's when their immune system is not quite yet mature enough to produce the immunity it takes to handle the environment as effectively as adults. So the mom sharing that breast milk with the baby really protects the baby from the environment, reducing infections such as ear infections, respiratory infections, diarrhea. You'll experience less visits to the doctor, except for the scheduled ones. And the benefit to the mom is that it releases the hormone oxytocin, which helps to return the uterus back to its original size. It lowers the risk for the mom for breast cancer or ovarian cancer. It's also called the love hormone, which helps the bonding between the mom and baby to build trust and security for the baby. So the baby experiences this love from the mom that helps the baby kind of have that sense of security throughout, the baby's life. Breastfeeding also burns extra calories, which help lose pregnancy weight, and it can save you some money from not having to buy formula. And so those are some of the benefits for moms after, being able to breastfeed. Do you guys have any experience after the frenectomy in terms of how that breastfeeding changed with your baby, like the bonding or, maybe less frustration, better sleep, things like that?
I was telling Chris just the other day that I felt like I was a lot more together after having this baby. I wasn't as emotionally stressed. I wasn't snapping at the kids as much, probably because I'm sleeping much better. And I also feel the bond is a little bit closer with this baby. Could be because it's a girl instead of 2 boys.
Yeah.
But I was telling him these things just like 2 days ago. And I think that this experience is much better than the first 2 times.
Of the breastfeeding.
Mm-hmm.
What about you, Victor?
So mine, we had the frenectomy done on my daughter, and she was my first. I now have a son who's about 3 months old, but it definitely changed because before we had the frenectomy, I too thought that this is just how breastfeeding was supposed to be, and I almost got to the point where like you said, I almost wanted to avoid breastfeeding, but I definitely wanted to breastfeed, but it hurt so bad that I would contemplate like not having to feed, and so I would use the pump instead. But once we had the frenectomy, the first couple weeks after the first procedure we had, because you had mentioned that she had a pretty deep, I don't know, I guess a type of tissue, a pretty deep tissue.
Mm-hmm.
it got a little bit better, but it wasn't that miraculous awe that I had been reading about some moms sharing, that after the first time they latched and it was perfect. So we went back and had a second procedure with you, and it was after that one that I had already been working with a lactation consultant. So together, I think it just got a lot better, and I enjoyed breastfeeding her. Her sleep never got better. I mean, even now, once I've gone back to work after maternity leave, she's up once at least a night, and we have to get her to go back to sleep. So I think that's a whole other issue. But it just got a lot better. I think just our bond was a lot better afterwards. I didn't dread getting up and breastfeeding anymore.
Did you feel like you had better healing with your own body after the frenectomy process? Oh,
definitely. So before we had it, like I said, I had an open wound on both sides, but a lactation consultant was helping me to use the pump to be able to allow myself to heal. But even still, when I would breastfeed her, she'd open that wound back up, and so I got infected. But as soon as we had that first procedure with the frenectomy, I could tell that the wound was starting to close. And I went ahead and pumped a lot more just to allow it to close even more. But I could tell after the frenectomy that she wasn't opening that wound the same way that she was before the procedure.
Mm-hmm. So one of the things you mentioned that's important is that, after the frenectomy experience, some moms may experience still a little learning curve to get the baby up to speed. It's not a miraculous, when the tether is gone, the baby now knows how to breastfeed immediately, perfectly. It sometimes takes time. So my biggest advice is to be patient with yourself and your baby. Sometimes it may involve other people like lactation consultants, ENTs, chiropractors, pediatricians, and down the road, speech pathologists to help that transition. But expecting a sudden change is not always realistic for some babies because they've only been alive for a few days at that time. And so they have muscle memory for when they had the tether. So they know that, okay, I can only go this far and that's how far I can go. So the baby's muscles need to learn how to adapt to this new freedom. And so it involves a lot of exercises with the baby to allow the muscle to do a little bit more than they used to. And I just think of it as this healing process takes time. Imagine you had to run your whole life with your shoelaces tied together, and then you're kind of stumbling and falling all over the place. And then when someone comes along and cuts your shoelaces apart and now your legs have the freedom, it doesn't automatically mean that now you can just get up and run. You're still probably going to stumble and fall a little bit until you learn how to coordinate that really well. And the baby's goal inherently is to survive, is to get nutrition that it needs and to bond with mom. So the baby will always try to do what they're naturally supposed to do and what they are programmed. But that learning process does take some time with some parents. But even we've seen not just infants, but also younger children who have issues with the lip tie sometimes. A lot of times it's gone unnoticed because the nursing process wasn't very bad or the mom was using formula and didn't notice it. But a lot of little kids that have that lip tie that persists even after the period when they're learning to walk and they were supposed to fall and break that and then did not break it, there's now a lot of tissue right between the front two teeth. So the front two teeth are not closing together. They're separated, and usually those children will try to avoid using those teeth or try to avoid brushing them, or there's a lot of avoidance behavior. Do you have any experience with that?
Yeah, that's kind of where I fall in. I didn't breastfeed my child. She was my last baby, but with 3 others, I just didn't breastfeed. It was straight to formula. But had I maybe breastfed, I would have probably found this out early on. But in my case, it was after doing all the frenectomies with you. Doing it, we did so many that I didn't even think about looking at my own child. It was actually my husband who ended up noticing it. He saw her lip one day and was like, that looks kind of like she needs one. She has a lip tie. And I said, you're kidding me, really? So I took a picture and I kind of looked at it and I was like, oh my gosh, you're not kidding. She has a big old tether. She really does. She actually had that kind of almost like a class 4 where she has the notching. So she had that tissue all the way in between her teeth and where her 2 front teeth would be. So obviously they weren't going to close in when they came in. So we brought her in probably a couple years ago. So she was about 6. So I've only worked on babies. Never, usually we don't work on too many toddlers, but her being old enough, I figured she can understand what we're doing. So we did her procedure, which was kind of nice because I almost like babies, we obviously have them cry here and then, so we can kind of work on them. But with her, I was able to at least talk to her and ask her how everything was going, how she felt anything bother her. But she was cool and calm watching a movie and had no problem with whatever we were doing. She didn't know what we were doing. I tried to explain, but she didn't care. So we worked on her, but I didn't realize how important it was to kind of get all that tissue removed for her to make those front teeth come in, because she did have quite a big gap in that front. There was a lot of tissue there. But after the procedure, she was fine. Everything seems good. I mean, her front teeth came in pretty good. She still has a little bit of a space, but probably more because she's a thumb sucker. So that's probably completely another story on that one. But that's more of our issue. Speech-wise, I don't know if she really had a big problem with any words. Maybe, possibly a little lisp here and there, but after that, I think she's been fine. I haven't seen any other problems with her.
So for kids, did you notice that she was able to eat with her front teeth more and not avoid brushing because it doesn't hurt as much?
Yeah, she kind of did avoid a little bit to bite it with the front teeth. Like food, she'd always chew more on the side. She would pull food from the side, brushing her teeth. She wasn't as dedicated to the front teeth as much as she wanted to be. She would kind of have the brush kind of like more to the side a little bit, wouldn't really let me do the front teeth. So I guess it was just too tender for her. So, but I think now she's fine. She hasn't given me any problems with it.
If that front 2 teeth do not close as, the child grows up into adulthood, a lot of times this can lead to self-confidence issues, because sometimes they might always feel like I have a gap between my front 2 teeth. And even if orthodontically they can move them together, if they stop wearing the retainer, that tissue can pop the teeth apart again. And so that's something that can persist even into adulthood, which can affect social situations. And if there's still a tongue tie, sometimes that tongue tethers and pulls the gum down and creates a space between the front 2 teeth on the bottom as well. So those gap issues between the front 2 teeth are clues as an adult if you still have that tissue there and would need to get that treated. So I'm going to kind of finalize this by kind of discussing the difference between what are some of the options for parents that have this experience with their babies. So the traditional thing to do would be to use a scissors or scalpel. And the pros and cons of those procedures is that scalpel and scissors are fast. So instantly it can be cut and the baby's done. The problem with that is instant gratification isn't always the best, because when that is cut, the baby will tend to bleed more and have more pain post-operatively, which means the baby will now avoid breastfeeding because it's painful to try to use their lip or their tongue. So having that procedure done sometimes can also stop the breastfeeding process from continuing, because the mom trying to get the baby to eat will try other ways to try to get the food in, and it may just result in, going to formula. The other thing about that is if it gets more infected, because now there's an open wound in the baby's mouth, that can cause more problems too for the baby. So the other process that can happen is laser. So the way that laser works is that laser, for example, we have a light laser. It's a dye laser which seeks out pigmentation of tissue and as well as fluid. So the only way the laser can work is it can only seek out a few cells at a time. It kind of dissolves it as we go along. It takes a little bit more time than just cutting through, but it doesn't allow as much post-op bleeding. And the baby's usually, after we just topically numb, and afterwards the baby should be able to nurse within 3 hours. Sometimes 5, sometimes 1 hour, depending on the baby. And then parents will use vitamin E oil to kind of help to soothe the area and help them with their exercises to help the baby learn how to use their tongue and their lips again. So that, I feel, is a little bit more gentle on the baby long term, because they do not have that post-op experience at night, after the procedure, the mom frustrated with the baby not even wanting to latch on at all. Usually those babies latch on pretty quickly afterwards. Do you guys have anything to share about why you chose a laser frenectomy experience versus like a traditional?
We didn't actually make a decision between the two, but having come to somebody that was doing it with a laser, we were really comfortable with that. I have a little bit of experience with high energy industrial lasers, and I've also read a lot of material about what's going on in the medical industry with lasers, and so I was pretty comfortable with that idea. I actually, for the same reasons you just listed, preferred that option over cutting, because with cutting you do have a longer healing time and you have the potential for bleeding, when I actually held a baby during this procedure, so I got to watch it, and even myself, I wondered how you're going to get a laser in a baby's mouth. Well, so I'm going to talk a little bit about that. It was a much more a less invasive procedure than I was imagining. The device, the apparatus that actually is used to apply the laser is very small. It's what would you say, like a pin?
Looks like a needle.
Like a needle, yeah, coming off of a pin, and so it didn't, it didn't seem to bother the baby. She seemed to be more frustrated with being restrained than she was with what was going on in her mouth, and she was able to nurse within a couple of hours after the procedure was over. It was relatively quick. I know you mentioned it takes a little longer than a cutting procedure would with a blade, but we're talking a few minutes. And overall, I think it was, obviously ours was a very successful procedure. We were really happy with the results.
Do you have similar experiences?
Yeah, so for us, we, when our daughter was about a month old, that's when we had met with a lactation consultant that told us about our options and encouraged us to get a frenectomy. And my husband was really adamant against a frenectomy. I think at the time we were both just so new to parenting, and I don't think he understood, the pain I was going through. And so he actually started researching because I was almost having to come up with like this proposal as to why this was so important to me. And so he saw the cutting, and we didn't know that laser was an option at the time. And he was just like, no, we're not going to do it. I don't want to see my daughter bleeding. Like, we can't do this. So when we found out about the laser, he still wasn't excited about it. He still was really strongly feeling that he didn't want to have this done. He didn't think it was necessary. But he went ahead and he was the one that held her. And he noticed too. He said, she fell asleep during the procedure, and there was no blood. He said it was a little hot in the room, but he's hot-natured. So that was his only complaint. He's like, our daughter fell asleep, and I was in another room, and I could hear her crying. But from what I understood, you needed her to cry so that the tongue would lift up. And he said that it was, faster than what he thought, and he could tell that she wasn't in pain. She was just more really mad that, she was restricted.
We annoy babies.
So it was really, for me, I thought, because I wasn't in there, I thought it went really quickly. I think for him, he was just really surprised at how non-invasive it was, and how, his little baby didn't seem to be bothered by it.
Yeah. So it's kind of funny that a lot of dads are the ones to hold the baby, because moms, when they hear the baby cry, they start lactation process, and so the whole time, if the mom's holding, they're letting down milk, and they're getting frustrated, and the baby's crying and everything. And the reason we want to keep the baby conscious and crying is because we don't do sedation for babies. When they do that scalpel, sometimes, because it could be painful, they may have to sedate the baby, and I'm kind of I want to be as less invasive as possible. I don't want the baby to have to go through all of that just for a small, tissue that can be numbed topically. And so if the baby's sedated, the only way to get that mouth open is to pry it open, and that can damage the joint around the jaw too. So that's why, I rather just the baby voluntarily open their mouth, even if it means crying. It helps us get access, and the baby is a little upset with us because, the baby just wants a nipple, not, anything else in the mouth. And so, but it makes it faster, because when the baby falls asleep, then we're back to kind of square one, like, how do we get the mouth open and everything. So it's really fun. We've been doing this for a couple years now. We probably saw over 100 babies by now, and I'm glad that you guys were able to come out here and share your story. I really appreciate that. So I know a lot of moms out there have a lot of questions about this, and I hope this clarifies some of their concerns and questions about what this is, and hopefully it can help educate some moms out there. Thanks so much.
All right. Thank you.
Thank you so much.
Yeah.
Sometimes with this kind of stuff, it's like I have some stuff prepared, but then I don't really know where the conversation is going to go. So
It went well. I think it flowed right.
I just kind of go with it.
You did good.
Yeah.
One thing that you should probably put in, and I was going to try to sneak this in, but I forgot, was the fact that it's a very inexpensive procedure, comparatively speaking, to a lot of,
And in comparison to formula.
Formula,
The fact that you all allowed me to keep breastfeeding and not have to go through all that. And
Yeah.
Can we add
Because
that?
she did mention she mentioned the
Can we?
she mentioned the inexpense of
from
formula.
Yeah.
But she didn't say the
You wanted to
expense
add
of
something?
the product.
Well, I think he has something to say about the cost versus, the alternative cost, which is formula and procedure at the hospital. Right?
Yeah, we can find a place to put that in.
Add that in.
You want to do that real quickly?
you could lead in by asking if anybody has anything else they'd like to add or something, and I could jump in.
Does any parents have any other advice for other parents out there that's trying to make a decision about whether or not they want to do something like this or even look into it?
I would like to point out the affordability of the procedure, that it's, compared to even, the cost of formula, it's a pretty inexpensive procedure to have done. I'm sure it's less expensive to do the laser in an office setting. I didn't really price the difference, but as opposed to, every single time I've ever set foot in a hospital, I've felt like I got mugged, So, but doing an outpatient procedure at a local dentist's office, it was very convenient, but it was also, it was very affordable as well.
And the price versus the pain. There's no way I would have wanted to continue to nurse for the next year or 2 years and be in pain. You could never get me to do that again.
I think too, like you mentioned with the pain, but just knowing that a simple procedure that's safe and that is causing, very little to no discomfort to the baby, but that gives you a stronger bond, but it also allows you to be completely pain-free and reach whatever goal you have to breastfeed, that meant the world to me, to be able to do that.
I appreciate that. Thank you guys for sharing.
You're listening to RMCN, the digital destination for premium talk radio.